Welcome to the next short video on the instruments used for suturing. We've already looked at the needle holder and we've shown that we grip it with the ring finger, and that enables us to palm the instrument and have complete control over the instrument and the needle, and we've learned how to ratchet and unratchet the needle. Hopefully you've done some practice of that, and now we're going to move on to the forceps. Now the forceps have two roles. They're designed predominantly for grasping tissues, and what we tend to advise people doing, if you can, is grab below the skin so that you don't damage the skin when you grab it. But sometimes you have to grab the skin, and if you do so, you don't need to do it hard at all. It's just to position the skin to enable you to get the right needle angle when you're doing your efficient suturing. You can lift the skin gently onto your needle like we've done in previous videos. What I want to show you today is how to safely handle your needle and spin your needle. So at no stage really should you be handling a needle, particularly a dirty needle, with your fingers. In reality, many people do, but that's not good practice. And therefore it's really important that every time you handle your needle, you're passing it between your needle holder and your forceps. And that's the first skill I want you to practice, passing your needle between your needle holder and forceps. The next skill I want you to practice is turning your needle. We've looked at mattress suturing, and we know that with mattress suturing, we're going to come across from one side of the wound to the other side, but you know you want to travel back in the opposite direction. So to do that, we're going to have to retrieve our needle and, using economy of movement, switch the direction of the needle so that we can immediately return. Okay, so what we're going to do now is we're going to practice switching the direction. So with a normal grip on the needle, with our ring finger in the hole, we've got the needle. What I want you to do is grasp the needle about 3/4, 2/3 from the tip, and as I pronate my right hand, the needle will spin. Okay, slightly different if you're left-handed. Most people are right-handed. So grabbing the needle facing up, so you're going to be stitching this way or towards you using your shoulder, and then we're going to grasp the needle. We're going to release our hands and let the needle spin in the needle holder. So I've released the ratchet, spin the needle, and then I'm able to stitch away from myself. So I want you to practice that now. Just take one long length of suture, such as this, on this wound here, and I want you just to pass it towards you, grasp it with your forceps, bring it out, grasp it, spin it, and go back. And the quicker you get, you can do it closer to the skin. So I'm turning. So when I'm spinning away from myself, I actually need to actively spin it. But interestingly, when you're working away from yourself, if you just grasp it with your forceps and lift up, you can actually spin the needle using your forceps. So there are two different techniques to spin. So again, coming back towards myself, I'm going to have to actively spin it. Going away from myself, I can use a one-handed technique. Okay, and there you've got it. A continuous horizontal mattress suture, which you've learnt from your advanced suturing. But that's a quick video to show you some advanced skills on how to spin your needle and handle it safely using your forceps.